Hi there, my name is Laura from Pepperdine University Graduate School of Education and Psychology. I'm sure you've heard a lot of rumors about ABA therapy. It's a popular treatment for people with autism spectrum disorders or other developmental disabilities. Some people think it's a miracle cure, while others think it's harmful. ABA therapy is based on the theory that behavior can be changed by reinforcing desired behaviors and reducing undesired behaviors. It's been found to be effective in treating autism, but it is also controversial. Some critics argue that ABA therapy does not address the underlying causes of autism and that it can be harmful to children. Much of the controversy around ABA therapy comes from misconceptions about the treatment. With that being said, let's dive into the background and 7 of the most common myths about ABA therapy and clear them up once and for all. What is ABA therapy? ABA is a treatment for individuals on the autism spectrum. The goal of ABA therapy is to increase behaviors that are helpful and decrease harmful behaviors. This method has been proven effective at teaching communication skills to children with autism. Therapists have been using ABA since the 1970s to help children with autism spectrum disorders, and as research has continued over the years, techniques continue to evolve and improve. Here's an example of how ABA therapy can help: enhance communication and social skills, improve developmental skills and social interactions, decrease inappropriate behaviors, teach skills that are used in everyday life. Antecedent, behavior, consequence. Have you heard of the ABCs of ABA? It's a really important concept to understand if you're wanting to make changes in your behavior. The ABCs stand for antecedent, behavior, and consequence. Understanding this sequence is a foundation of ABAs and helps us to understand why behaviors occur in the first place and why they continue over time. When the therapist has a strong understanding of the context in which a behavior occurs, they can create an effective behavior intervention plan. The antecedent refers to what happens before the behavior happens. It could be a verbal command or request, something physical in the environment that triggers a behavior, or a thought or feeling. The behavior itself is the action that we want to change. The consequence is what happens directly after the behavior. Consequences can be positive, negative, or neutral. Positive reinforcement. Positive reinforcement is a crucial component of ABA. It involves rewarding the client when they choose a targeted behavior, such as following directions or making eye contact. Positive reinforcement helps the client learn that doing the desired behavior will lead to positive consequences. Over time, this leads to behavior change. A behavioral analyst might use positive reinforcement to help someone learn how to brush their teeth properly. The analyst could start by asking their client what they enjoy about brushing their teeth. This helps their client understand why it's important to do it. Then, the therapist may give the client a small reward each time they brush their teeth correctly. Over time, the client will build the habit of brushing their teeth regularly. Who provides ABA therapy? You may not even realize it, but the concept of ABA is used widely throughout everyday life. Parents use positive reinforcement by allowing their kids to have dessert after they've put their dinner dishes in the sink. Teachers use principles of ABAs as part of their classroom management system when they allow kids to pick from a prize box after they've had a great day or followed directions. Something as simple as acknowledging your spouse with a thank you for taking out the trash encourages them to repeat the behavior in the future. But not just anyone can provide formal ABA therapy. Formal ABA therapy is typically provided by a board-certified behavior analyst, a board-certified assistant behavior analyst, a registered behavior technician, or a paraprofessional in a formal educational setting. Myths about applied behavior analysis therapy. Even though ABA therapy has been around for 5 decades, and has been shown to be an effective method for helping individuals cope with difficult behaviors. There are still many myths and misconceptions that surround the therapy. It's important to clear up misinformation so it doesn't become a barrier for those who need therapy. Myth number 1: ABA therapy isn't backed by science. I've heard that some people think ABA therapy isn't backed by science, but that's not true. There have been numerous studies that prove how effective ABA is for people with autism. The U.S. Surgeon General and the American Psychological Association both recognize ABA as a best practice for children with autism spectrum disorders, as well as adults. Studies have shown that when ABA therapy is delivered consistently for 1 to 3 years, children with autism see improvements in intellectual and social functioning, as well as language development. Myth number 2: ABA is only effective for people with autism. ABA is a really powerful tool that can be used to help people with all kinds of disabilities. In fact, it's used in a lot of different contexts, like in rehab for people with brain injuries or in education and sports psychology. ABA is so effective because it's based on studies of human behavior and how our brains react to things. The goal is to teach people new skills through positive reinforcement, which can be helpful for anyone who needs behavioral interventions. That's why ABA is such a great tool for helping people with autism. Myth number 3: ABA therapy encourages people to bribe children. People sometimes confuse the word bribe with the actual concept of reinforcement. With positive reinforcement, you provide a reinforcer after a behavior in order to encourage that behavior to happen in the future. In the ABCs of ABA, you can think of the reinforcer as the consequence, or what happens right after the behavior. Bribing, on the other hand, is typically associated with a negative behavior. It happens before the behavior happens. There's a big difference between "if you're quiet during story time, I'll give you a cookie," and "you practiced active listening during story time, so now you can have 5 minutes of free time." Myth number 4: anyone can provide ABA therapy. While it is true that anyone can utilize the concepts of ABA, only those with the appropriate credentials can provide this behavioral therapy in a clinical setting. To be an ABA therapist, one must be a board-certified behavior analyst, a board-certified assistant behavior analyst, a registered behavior technician, or hold the appropriate credentials as outlined in the requirements for eligibility by the state where the person is providing services. Myth number 5: ABA therapy encourages punishing children. The foundation of ABA therapy is rewarding positive behavior, not punishing behaviors. While punishment may have been common practice as late as the 1950s, advancements in research have come a long way and have shown that punishment is not the most effective course of action for correcting a behavioral issue. Myth number 6: ABA only addresses behavior issues. When we think of behavior issues, we often think of children acting out in the form of tantrums, hitting, or yelling. But in the context of applied behavior analysis, the true definition of behavior is any action that a person does. It's the B of the ABCs of ABA. So while ABA therapy can address the negative behavior issues we associate with the word, it also focuses on reinforcing daily living skills and social skills. Myth number 7: ABA therapy can cure autism. While there is no cure for autism, ABA therapy aims to help autistic children and adults cope with their challenges and learn to live more independently. Applied behavior analysis is a powerful intervention for improving communication, socialization, and self-care skills, but the goal is not to cure people of their autism. Research has recently shifted to early intervention as a focus, rather than finding a cure for autism. Many people who are neurodivergent argue that trying to cure autism indicates the need to take away their personality and a core piece of who they are as a person. ABA therapy, on the other hand, simply offers tools to help individuals become more independent and successful in life. Are you interested in a BCBA degree? If you're thinking about becoming a behavior analyst, you should consider enrolling in Pepperdine University's MS in Applied Behavior Analysis program. This degree program prepares students to become board-certified behavior analysts and work with children and adults with autism. With over 50 clinical practicum sites, students will get quality hands-on experience working in an ABA-based setting while they complete their graduate degree. For more information on Pepperdine University's MS in Applied Behavior Analysis program, or to apply, visit the links in the description below. Thanks for watching. Don't forget to like, comment, and subscribe. Have a great day from Pepperdine University.